I hope you're going to hear me. Sorry to say I have a little bit of a cold, but probably this can work out anyway. So what we're going to talk about now, this first presentation, is basically around the work package 4 in Prime Care IT, where we have focused implementation, or actually investigation first and then the implementation of teleconsultation. Later on, we're also going to get some examples, some brief looks at some of these pilots. But I start with a presentation on the context. So if you're looking at the whole intention around such a work package, it was to explore where the teleconsultation and then also telementoring could aid in reducing the possible problem of professional isolation, and also, of course, help where we have less population density. Actually, when you have less people around, of course, the cost is going to be raised in terms of healthcare. So technology can help here. So the whole point was to try out teleconsultation, basically virtually, by using technology, aid professional healthcare workers to get closer to their peers, and also, of course, in the long run, help patients. But if we start looking at a little bit of the aim with the teleconsultation work, there was a little bit of a request for primary healthcare workers to investigate in this. And what we were aiming at in Prime Care IT was basically to look at how we could successfully implement and test teleconsultation in pilots. The aim here was to try out 7 pilot sites in remote areas in 5 different countries within this Baltic Sea region. And this is something we also have done. Then the point was to validate these teleconsultation solutions in the remote primary care. And this is also something that has been done. I'm going to report upon the results. And then I think the last task is to prepare the possibility to make sure that these pilot sites grow into more steady state operation in terms of teleconsultation. This is more or less things that has to happen after the project is done, but we also set in place the development of a lessons learned and best practice handbook in order to achieve this goal. So if we go into the objectives with teleconsultation work, there are a couple of objectives that we are targeting here in Prime Care IT. And one is, of course, to enhance the connection of health professionals within primary health care and the cooperation also with the secondary healthcare sector. So when we think about this, the primary goal here is to connect the healthcare workers. So there have been lots of tests before where you put the position of healthcare worker towards a patient. In some of the pilots, this is also the case, but the primary goal here was to connect the healthcare workers. And also another objective was, of course, to enhance the use of technology, basically, ICT, for collaboration of health professionals within primary health care. And the third task was to look at this in remote areas, because this is what is seen as the problematic area. It's very easy to get professionals to work in big cities. They feel confident, they have all the knowledge they need present there at their hands, but as soon as you go into rural areas or less populated areas, you get a problem. And there are a couple of different things around that. One is, of course, you feel isolated as a professional. The other one is actually that you get an insecurity among the people living in an area because they don't feel that they have the right competence at their fingertips. So by using teleconsultation, there's a possibility to achieve this. So if you go through the different work tasks we did in the work package, the first was to start doing the situation analysis. And it is basically to understand how is the context looking in the different countries. We all know we have different healthcare systems, so it's really important to understand what is similar, what is different within the different regions. So this has been done and this is documented. It's possible to download this documentation also through Prime Care IT. After that, we did literature study, and this is basically to understand where the state of the art is in terms of technology. Because teleconsultation, you can actually do teleconsultation just by using a smartphone. You can do it by using Skype or other technology. So you have to do a constant inventory check in terms of what technology is available. And the typical matter here, if we look at this study, is that technology is becoming cheaper and cheaper. So if you go back 10 years, there were people who were talking about cost of 30 to 40,000 euros to implement teleconsultation in terms of technology. Today, it's basically, if you have a smartphone, you can try something out. But then you also have to look into the methods and tools in terms of how you develop and deploy teleconsultation. The third task we were looking into was the needs assessment. And this is to try to find out what do the different regions have, where do they stand, what technology is available. Because it's kind of useless for us in a project to start out by just buying a lot of equipment and then pushing that equipment out to all the different regions and say everybody's going to test the same. So instead here we looked at what was the specific situation in each region, and then trying to do the inventory check and then basically go purchase the right equipment for each situation. After that, it was the process assessment that was done, looking at, since we have the different contexts, healthcare works a little bit different, so we have to deploy a certain process to get things implemented. So that was the one task. Another thing which kind of comes as an unwanted item, but it's always going to show up, is the legal assessments. Whenever you want to do something like this, someone is eventually going to say, you know, we can't do that, we can't break firewalls, we can't do this because of patient safety, we can't do this because of this and that. So we also had to work with that struggle. Part of those questions were then, of course, fed into the work package 6 in terms of stakeholder involvement. But in general, we also had to deal with it in work package 4. After that, simple thing, just deploy the pilots. It's actually really simple. It's more complicated to get them running up at speed, but to just deploy them is simple. After that, we did evaluation, and this is what is ongoing now. And the next phase, until we quit this project in March 28, is to do the actual best practice handbook. So if we do a quick look, I will go a little bit deeper into this. We have 7 pilots spanning the regions. So you see the kind of geographical region of prime care IT covered here. 7 pilots, and down in the right corner we have the basically deploy scheme. If we go deeper into details here, this is how this kind of plan looked like when we were starting out prime care IT. And we have milestones that we have to achieve. So we have a couple of milestones, and now we are up here in the final phase of the project. And that basically means that when we're looking through the work process I was talking about, we have made sure we have these outputs. So any person who wants to know more about the project can, of course, after the project is done, start reading these outputs, because you will find all the information there. Here in the center, we have the core of prime care IT pilots in terms of teleconsultation. It's each and every individual pilot we are deploying. And I'm going to do a little bit of a quick run-through of these pilots. Just going to make sure I have track of the time here. Yes. So the first one was in Sweden, was with teleconsultation with Wound Care Center. And we're going to hear a little bit more about this one later on, more in detail. But we did get outcomes here. We ran basically 4 different types of teleconferencing, teleconsultation, and they all got an outcome. And basically what we see is that the consultations are working, and we have some pros and cons with them. And since I'm going to go deeper into this pilot a little bit later on, I will not dwell on it right now. The same second pilot in Belarus, looking at professional support of doctors, the general practitioners, from remote areas using teleconsultations. And interesting here, we are showing brief aspects of each pilot, is that you see that you have evaluation criteria in terms of satisfaction when we're running these tests. Pilot 3 was in Finland, and this was central hospital to home care units. And also here, here we have kind of done evaluation in order to get a score for how people perceive doing teleconsultation in this kind of context. Fourth pilot was also done in Sweden, psychogeriatric in distant rural area. Also here, things have been working out fine, and the pilot is finalized and documented. Fifth pilot was with Lithuania, Vilnius University Hospital. And here basically the task was to explore technologies available and see how we could use technologies in these teleconsultation and telementoring situations. Pilot 6 was the Estonian Vormsi Healthcare Center. And I think most of you have seen Madis showing off this equipment outside today. Otherwise, I recommend you to do this because this is a truly mobile unit. So also around this unit, there's been testing and piloting going on. And there's also, of course, in the pilot documentation, mentions on processes, technology, feedback, and everything. And then the final pilot was the Natural Health Survey. We're supporting GPs from remote areas via teleconsultations. So if I'm going to do a little bit of conclusion around this, the aim was to run and test 7 pilots. Luckily enough, we actually done this also. So all 7 pilots have been implemented. They all measured both the attitude and experience during sessions. So we did look at quantitative data, basically how many sessions you were running, but also the qualitative data. What did people think? How did it work? How did it work around the pilots, basically the decision makers, not only the doers who were doing the teleconsultation. The pilots report back that teleconsultation helped to improve professional capabilities in remote areas. This is one of the goals we wanted to achieve, so that's good. Participants say they felt less isolated, and also having self-confidence in making decisions and solving cases improved. And this is really good, of course. If you're looking at the aspect of teleconsultation as a tool for counteracting brain drain, this was not seen as a fact in the study. So we are not sure if that was really a true cause, because it was not seen. But still, it's a helpful thing to have to make sure that you support, especially the young practitioners going out in rural areas. Because I think having the ability to rapidly connect to a bigger knowledge source is something which is highly sought after for the young professionals. And also we see as a final conclusion that teleconsultation is a modern approach, a good tool to develop professional experience. And also I think it's not a matter of if you should implement it, it's basically around how and how to get it integrated in your daily processes. And if you have more questions on this, you can of course contact me as the work package leader or Sami as the lead partner of Prime Care IT. So by that, I hope I finished in time. Yes. And I say thank you. And we have questions later.